Hello, and third and final session in our webinar series with our great partners, Children's Funding Project. And we're really excited. I think I've said this all along that we learned about fiscal mapping. For those of you who, again, may not have attended all three of these, the first one, we took a journey around fiscal mapping. And the second one, we took another journey around cost modeling. And this one, I think, and Olivia, for you and Allie, just to know too, which I think you do, but tax revenue, I think this is one of the uncharted new frontiers for this audience and very timely considering where we are in terms of the fiscal environment and needing to really be creative and think outside the box for our babies and families coming up. I never even thought it was possible to make the pie bigger. So I am very excited to hear what you have in store for us. But before I turn it on over to you, I just wanted to note a couple things. One, for those of you who may not be familiar with our financing policy project, it is the baby of our 0 to 3 IECMH team, if you will. And next year will be our 10-year anniversary, our 10th birthday. And we're super excited. So far, we've been working, it's a national community of practice where states come, different states that we've been working with bring teams together and we really dig into the weeds to talk about what exact policy and financing levers we can use to make sustainable our infant early childhood mental health services and systems. I'm going to put a link in the chat to learn more information. We are working with up to currently 36 states. So if you have a question, if you are not sure if your state has a team, please reach out to me. I will also put my information in the chat. We really love to take these opportunities to make in-state connections when possible. So we'll do that. And also, if your state is not currently participating in the financing policy project, we're going to start cohort 5 in early next year, hopefully in the spring of next year, to welcome new cohort 5 states in. So more information to come on that. And in the meantime, we have a fantastic session for you today. Allie, it probably looks familiar if you have, for those of you who've been with us for the last 2 sessions, Allie with CFP here. And then Olivia is our newest presenter today. And fun fact, I should have known this, but didn't, that Olivia co-founded CFP. So thank you so much for that. We say you are an absolute gem as a resource for our states. And I also recently learned that you have supported 7 successful campaigns to establish local voter approved children's funds, which generate now over $150 million annually. So that's some serious street cred. Thank you for doing that. And we're excited to hear more. And also that you have a background, you work for the National Center for Mental Health and Juvenile Justice in the policy research area. So mental health, maybe infant mental health might not be your first language, but definitely have the background of mental health to lean on. So we're very grateful for the both of you today. I'm going to pass it on over to you in just a second and say, yes, attendees, you're already doing it, but please put your, say hello in the chat and where you're from. Please use the Q&A box. We will have time in the end for questions, and sometimes, wonderfully, the chat gets super busy, and I'm going to keep my eye on them to track it all. But if you have a question for sure that we're not answering, pop it in the Q&A chat, and we'll be sure to mention it. So with that, I'm going to hand it over to the two of you, and thanks so much.
Thank you, Megan. Good to be here with everybody. Thanks so much for having us. If this is, like Megan said, this is our 3rd webinar of this series. If you've been to all 3, please drop an emoji in the chat or something so we can celebrate you for riding along this journey with us here. So this today is all about filling. Oh, yes, look at all those emojis. I like the ghost. So today is all about filling the funding gap. So our first session was about what's all the funding going to IECMH. Second one is what's the true cost to understand how much we need to go for. And then today is about filling the gap between those 2 numbers. And Olivia's the lead of our action team here at Children's Funding Project is what we call it, because it's all about action for going out and winning new funding. If you have not dropped an emoji in the chat because this is your first webinar with us, just quickly, we are a national social impact organization. We work with states and communities and also Native nations to do what we call strategic public financing. And it's all about expanding opportunities for children and youth. So next slide, please, Olivia. What we mean when we say strategic public financing is just, I think the origin of that term, if I haven't said this before, is, you start with a strategic plan or any set of goals or policy priorities, in this case for IECMH. You have your plan, and then we're just trying to add the public financing part to the plan. So adding a price tag on those goals and then finding ways to cover those costs. So we used to call them strategic public financing plans, and I think just drop the word plan there. So next slide. What that really looks like, which this should be familiar to some of you all if you've been in the series here, is answering these three questions. So really doing our fiscal homework and having hard numbers to answer how much funding is supporting our goals right now through the methods of fiscal mapping. How much will it cost to fund our goals in full through cost analysis and modeling? And then how do we fill the gap between those two things, which is really thinking about a whole new world of options that people in other maybe adjacent fields have been leveraging over the years, but not always child and youth advocates. So today's about sort of expanding our horizons, about thinking what are about all the options out there. All right, so next, oh yeah, here. Okay, so I didn't want to get to that preview of the poll, Olivia, which is why I freaked out there. So next slide. Okay, so our agenda for today, Olivia we're going to talk about all potential sources of additional funding out there, run through a ton of examples, because I think that'll be helpful today to just hear about how different states and localities have connected all of these pieces and generated new funding. And then think about some applications to work in your state or community, and maybe some partners we can sync up with along the way. So we're going to start with just a quick poll, if we can get that going. Just a couple questions. This is Olivia's first time with the group, so to hear what you all are thinking about in your states and communities, and also just for you all to learn from each other here. So our three questions: what funds currently support IECMH services in your state or community? Have you ever been asked any of these questions when pursuing funds, and what partners are you already connected to? We'll give you a minute or two for these. Renata, just feel free to give us a shout when we have a good majority here answered. All right, I think we can go ahead and close up the poll. I don't know if Renata or Megan, if you're able to close the poll and share results. There we go. Okay, great. So what funds currently support ICMH? We have federal funding streams, state Medicaid, other state dollars, city or county funds, philanthropic dollars, and I'm not sure. So a little bit of everything there. And then have you ever been asked any of these questions? So the number tie for the number one response is how much is it going to cost and where's the money going to come from? But again, people are hearing a lot of these questions. And then which partners are you already connected with who are also pursuing, funding for children It looks like we have a lot of good partnerships happening in your communities, maybe less about economic justice organizations or your state's budget and tax organization, which is great because we can talk about fostering those connections a little bit today. And if anyone wrote other, please do share in the chat to give other people ideas of partners here. Okay, great. So thanks for doing that. One more slide from me. So we hear these in our work with states and communities across the country. We hear, you know, these are the questions that people get in pursuit of new funding, just like you all just affirmed in that poll, and just want to focus in on this, where's the money going to come from question today, and really bringing policymakers the answer to that question by bringing some options. So I'll pass it to Olivia to kick us off here.
Thanks, Allie. And hi, everybody. Nice to be with you. My name is Olivia Allen, and that was a lovely introduction, but correct that I am a founding member of Children's Funding Project, and in my role here, work on helping people answer this question of where's the money going to come from. So like Allie said, if we're looking at how we're going to fund our infant and early childhood mental health goals, on the left, you'll see you have kind of an insufficient amount of funding. I would hazard a guess that funding is not sufficient to reach your goals. And it comes from kind of this group of sources on the left here. We listed some funding for IECMH. And then if you were to do a fiscal map, you could get really precise on what those sources of funding are. And if you were to do cost modeling, you could figure out how tall is that kind of total fundraising thermometer, for example. What is the funding required to reach our goals? And my team really focuses on where is the money going to come from. So this slide is really just about kind of giving folks a sense of the goal here is to broaden your horizons, give you new ideas about tapping into funding streams you may not have thought about tapping into. So it's a little bit misleading because it looks like there's kind of an equal amount of funding in our typical sources of funding and what other sources of funding are out there. But our thinking is actually that there are a broader range of sources untapped out there than there are funding sources we're already tapping into. So on the left, you'll see typical sources of funding that you may already be accessing for infant and early childhood mental health. So Allie put that poll question to you all, and I saw there were kind of smatterings of yeses in each category, but I think it's pretty obvious that we draw a lot on federal grants for infant and early childhood mental health services. We draw some on state matching funds, state budget allocations, Medicaid reimbursement. We rely some on philanthropy at all levels. And then in some cases, folks rely on fee-based services depending, but we're sort of limited to this set of funding sources that often are the funding sources that we're told these are the ones that are applicable to infant and early childhood mental health. On the right-hand side, these are a bunch of sources of funding that exist, but are basically never labeled as this is funding for infant and early childhood mental health. And so we may not know to look at these or look for these funding sources. And this whole body of work is a little bit inspired by folks like airport developers or real estate developers. Those folks have a bunch of money and a bunch of people who go out looking for what are all the available sources of public dollars that I could use to do development and fund something and get that labeled for my specific project. And what we're trying to do is kind of be that same sort of set of resources for folks like yourselves. So the goal here is to get us out of the mindset of just fighting over slices of the existing pie of what's available. For example, what might be labeled as being available for 0 to 3 or infant and maternal health or child health in general, and instead start adding on additional resources so that we're not just fighting for slices of a small pie, but we're able to actually get new slices of an expanded pie. And I also just like this image. I don't know the origins at all. If somebody does, you'll have to let me know, but I'd like to go to a place where they're shoveling up apple pie this time of year. And our belief here is that if you know more about the way that we finance public systems and the range of opportunities available to you, my goal is not for you to leave here today with a roadmap to securing one specific, source of of additional funding that's going to change everything. The goal here is to widen your lens so that we can add up more wins over time. So this is really just about giving you new ideas. Hence, I'm going to go through a bunch of examples before I make sense of some of the examples. And I'm really excited to hear, for example, this first one. If folks drop in the chat, have you heard of the Ready by 5 early childhood millage in Kent County, Michigan? Kent County is the Grand Rapids area. This is a relatively small fund. It's modeled after an elder care fund in Michigan. And in Kent County, a group of interestingly early childhood and disability advocates and business leaders got together and they said, hey, we have this senior millage. We have a property tax that goes directly towards offsetting the cost of senior care in our community. Why don't we have that at the other end of the life spectrum? So they got together and they were able to place a question on the ballot and have voters say, yes, we would like to put a small amount of our property tax, raise our taxes and put a small amount of property tax towards what they call the Ready by 5 early childhood millage. What's interesting about this millage is that it's broadly or more holistically focused kind of across the prenatal to 5 spectrum. So you'll see a lot of this strategy has been used in a lot of communities, or not a lot of communities, but a range of communities to fund pre-K, for example. But what I thought was really relevant about this example for you all is that it does include some infant and early childhood mental health supports and screening. So you'll see in their healthy development program area, you'll see they specifically list behavioral and mental health for early childhood. And obviously these other categories are related, but this is one of the funds that exists, local funds that exist that specifically funds early childhood mental health. Oh, and I see multiple people in the chat have said that they're aware of First Steps Kent. And Jillian from Michigan says this village supports so much. So I love that people have heard of this. One you may not have heard of, but again, would love to know in the chat if folks have heard of Our Kids, Our Future in Sonoma County. The reason you may not have heard of this is because it just passed last November. We supported this campaign for, again, it was a voter approved ballot measure campaign for sales tax revenue. It was a 1/4 cent sales tax increase. And it generates about $30 million, excuse me, for a range of early childhood services and supports. So they called it the Child Care and Children's Health Initiative. And in addition to supporting childcare provider wages and retention, childcare facilities, childcare workforce, they also had a focus on expanding early childhood and perinatal mental health support, and strengthening early intervention, screening and referral systems, and also had a focus on prioritizing children affected by homelessness. So this is just another example. So both of these are examples of places where advocates in a local community said, okay, what we have in our federal or state budget is not sufficient to take care of infants and toddlers in our community. We're not being successful getting what we need out of the local budget each year. We're actually going to go to voters and ask, can we have additional tax revenue? Can we grow the pie of revenue collected by our county and dedicate that to early childhood? This is another example of that kind of same strategy, but it is bigger, 65 million, and also has a broader scope. But one that I like about this that we'll come back to later is the way that they roll infant and early childhood supports into a kind of a cradle to career message to their community. But Best Starts for Kids in King County, and again, would love to know if anyone has heard of this. This one I feel like is one that comes up a lot in the child and youth field, so maybe more folks that will have heard of this, and it's a little bit older. But they invest $65 million a year of property tax into what they call early childhood, sustaining the gain, preventing homelessness, and supporting community. And specifically in investing early, which is prenatal to 5, they do social and emotional developmental support for infants and toddlers. So that's not the focus of why they grew the pie, but it has a dedicated source of funding. Infant and early childhood mental health has a dedicated source of funding in King County. Jumping from the local level to the state level, I don't know if anyone on the chat, let me look at the chat. Oh, yeah, multiple people have heard of Best Arts for Kids, and Sarah, appreciate that you voted for it, that you got a chance to vote for that on your own ballot. I'll just pause for a second to say, Roxanne calls out that King County is the largest county in Washington. I will say I also supported a campaign in Whatcom County. Yes, which Christine is just calling out, Whatcom County, Bellingham, Washington. Thanks, Christine. Which is a much, much, much smaller and I would say a bit more politically diverse community that is early childhood and homelessness prevention focused. And I will say the dynamics of those two funds, there's so many different things about those two funds, but what's really interesting is that that was sort of driven from outside of government. So Best Arts for Kids really came from county government saying, we hear that folks really want more dollars to be invested into children and youth, and we need kind of a sustained way to do that. In Whatcom County, it was a group of citizens, specifically partly led by philanthropy, who was just banging their head against the wall of this problem year after year and knew they needed sustained public funding to invest in early childhood. Yeah, they worked with us to put that campaign together and were successful and passed the Healthy Children's Initiative Fund in Whatcom County. And I'll say, obviously, it's slightly more complicated implementing a fund that doesn't come from within government, but government has to implement. But that's kind of a getting in the weeds on the nuance. But Christine, I appreciate that you've heard that, and kind of the point of that digression is just that we have examples from all different size and all different demographic makeup communities who've made that kind of investment through voter approval. I'll jump to the state level. I don't know if anyone here is from Kansas or has heard of the Kansas Endowment for Youth. And the reason why I include this example is because I think it's a really good example of staying aware of money that could be coming online, opportunities that could arise. Part of the purpose of sharing all of these examples is not to say, okay, go duplicate this exact example. You have the exact same resources as this other community or this other state. But it's partly staying up to date on what are the new untapped sources of revenue or new funding that is arriving to or coming into my state that I could make the argument part of it should go to kids. So you've probably heard kind of all across the country, Kansas is not all alone in this, but Kansas Endowment for Youth specifically put a share of their revenue from the Tobacco Master Settlement into early childhood. And I think most folks will be aware that the amount of money from the Tobacco Master Settlement is decreasing over time. But for now, it amounts to $50 million a year. And they invest some of that money into development, strong families, and early learning. So it's kind of the way it flows in Kansas is that the funds are deposited into the Kansas Endowment for Youth, but the Children's Initiatives Fund administers the funding across 4 different state agencies. So somebody's comment earlier on, Christine, your comment earlier on integrating these efforts with all the different things going on at the state level and across all the different efforts is a point well taken. And I'll also say this is a good point for why fiscal mapping can be so useful. Because I think otherwise it's hard to trace back funding streams to their real origin, which funding is actually coming from the state and state revenue, which funding is coming from something like the Tobacco Master Settlement that's sort of limited and time bound, which funding is coming from a federal grant that's going through the state. So this is just a good example, complexity wise, of how it might be under a different name, but this is a creative, dedicated source of funding that is going to infant and early childhood developmental services, if not specifically mental health, in Kansas. Similarly, this is a fun case study we like to do in Louisiana. So to my kind of comment about keeping track or starting to think about what funding or revenue might be coming online or what opportunities might be emerging, not just what exists now, but like what is on the horizon. A group of advocates in Louisiana did a poll in 2021 where there were all these different kind of potential additions to state revenue that they were looking at taxing for early childhood. They put a poll in the field and they said, would voters support any of these? And so they were looking at online sports betting and gaming facilities. There was legislation considering legalizing online sports betting at the time and making, I don't quite remember exactly what it was, but excuse me, some change to gaming facilities that would add state revenue from those facilities. And there was also legislation considering legalizing medical marijuana and recreational marijuana. And additionally, legislation considering maybe our taxes on nicotine and alcohol are too low. Excuse me, I got something in my throat. So they did a poll and found that super broadly, people were in Louisiana were supportive of, yes, go ahead and add a tax to this or collect tax revenue on this and put it towards early childhood education specifically. So I know that's early childhood education in their case likely doesn't mean specifically infant and early childhood mental health services, but I wanted to provide this example because I think it's a good one that's worth modeling off of the childcare and pre-K folks. So in 2017, the reason they were looking at these different funding sources is because in 2017, they did something that we recommend a lot of states do, where they just go ahead and pass essentially like a blank or empty bank account. So in your state, you could pass a main early childhood or infant and toddler healthy development fund or mental health fund. And they go ahead and pass that and you get it in the legislation. So then instead of the question of should this be something that the legislature funds or should this be something that the state does, the question instead changes to how are we going to finance the trust fund? So they started adding just these little bits of revenue as they came online. Oh yeah, this is the detail on what the gaming facilities thing was. Something to do with land-based casino revenue. Essentially they were able to jump on a moving train around land-based casino revenue and get a little bit of it to go, just a teeny tiny bit to go into that early childhood education trust fund. The same year, industrial hemp was getting legalized. So they said, okay, well, just a little bit of revenue, we're going to go into the early childhood education trust fund. And mind you, they're not seeing those as, I hear a lot of concerns from people of like, oh, if we get this small win, isn't that going to make people think, oh, we already funded that and prevent us from getting more and more wins down the road? And I'll say, I think Louisiana is a great example of no, just collect all the little bits of revenue and funding you can. And over time, it will add up. So in 2020, fantasy sports betting was legalized. It was online sports gambling was legalized, and a portion of the tax that was already in that bill went to Early Childhood Education Trust Fund. And then in 2021, sports betting revenue, which I guess is different from fantasy sports betting revenue, and the revenue from a specialty license plate also got added to that fund. So additional things have happened since then, but I just really, we love and I'm sure this is actually updated. We should probably get a new screenshot, but when we share the slides, the link will be in them to the Louisiana Policy Institute for Children's dashboard, which is just, I think, a really, really smart way to show people what as the dollars are stacking up, where are those dollars going and how kind of far are we from our goal. The other interesting thing about that I thought was smart, and to someone's point earlier about Louisiana, is that the Louisiana Early Childhood Trust Fund at the state level is a matching fund for local parishes that put local money into early childhood. So New Orleans ran a campaign similar to the ones I started this list of examples with, specifically for for childcare slots, but additionally for wraparound supports, including family coordination and other wraparound supports. By putting this question on the ballot about property tax, winning their campaign and getting $21 million a year in property tax in New Orleans, they're able to tap into this state fund and get a state match for some of that funding. And that creates this kind of synergistic relationship and pressure on the state, which has made this matching commitment to keep filling the state early childhood trust fund so that it can match local dollars as more localities put money, their own money into the fund. Switching over from state level to oh, and looking at the chat, I appreciate someone saying casino law in Louisiana is really complicated, and giving me grace for not knowing the specifics on that. I can tell you I'm not a casino law expert, but I appreciate that you don't need to be. You can hire a lawyer for that. You just need to be aware enough that legislation regarding that's going to bring new revenue online in a state is moving, and know to keep an eye out and say, can a little bit of that revenue get dedicated to early childhood, for example? Because none of the people who worked on at Louisiana Policy Institute for Children, they're very smart people, but I don't think any of them are casino law experts either. In Cuyahoga County, Ohio, I want to switch over to a non-state and local revenue example. I don't know how many folks have heard of Pay for Success. It's an incredibly complicated thing to implement, but I thought this was an interesting example to pull of folks leveraging both public and private dollars to support services that are not the same as infant and early childhood mental health, but are, I would say, in the same ballpark related. So in a pay for success model, a private entity will front the money for an intervention or program or service. And the folks implementing the intervention or program or service will say that money will get paid back to the private entity that fronted the money if we achieve a certain outcome. So I don't know why it says Louisiana there. But advocates in Ohio were able to secure upfront capital of about $4 million. And then a service provider used that capital specifically for 5 years to support families who were struggling with finding housing and staying in stable housing with a variety of interventions. And the goal of the service provider was to meet certain outcome thresholds related to foster care placement. Cuyahoga County had identified that they were really struggling with repeated and long duration foster care placement for children whose families were struggling to find stable housing. And so they said, okay, we need to invest in this intervention, but it's expensive and it's a bit of a risk. And the county said if it pays off, it reduces length, duration, and quantity of foster care placement enough by like a certain amount, if we reduce that outcome enough, then it will save us enough money that we can pay the initial private backer back for that funding. So these get set up in very complicated ways. A lot of the times there's a requirement to bond that money. The county has to like set that money aside in a bond and so that it's there to pay back the private payer if the intervention is successful. But I think on a small scale level, if you can tie your specific program, service, or intervention to a way that it's going to save city or county government money, there's a shot at implementing something like this. So I just ran through a bunch of examples. And people's kind of next question is usually, how do I know which of those to pursue? You only have, so much time in the day. How do I know which of those examples I should go chase down more information on, or might be applicable to my state or community or whatever level I'm at, which are even worth suggesting to a legislator? And this is going to be too much information, but just wanted to kind of get the juices flowing around this. We have categorized a lot of these examples into three categories. The first one is looking into your local taxing authority. So if you are in a locality, this is for folks who are in a city or a county, and you're specifically interested in that area, can I do what Kent County or King County or Sonoma County, and interesting that I picked all counties because this also happens at the city level, but can I do what any of those counties do? Can I ask voters if they would increase their taxes and give a little bit of that money in a sustained way to infant and early childhood mental health? The answer is different from state to state and even within states. In some states, it's very common. I'm sure you all know which states those are because you'll have seen it on your ballot before. You, as a voter, will go and you'll see questions like, are you willing to increase your sales tax by X% to fund fire and EMS? Are you willing to increase your property tax to fund new needs of your mosquito abatement district? Those are ones you might have seen in California or in Florida, but this is not available in every state, and obviously only works if you're in a locality and you have all the support you need in order to pull something like this off. So we run a free cohort of folks who are pursuing ballot measures for early childhood generally, to dedicate funding to early childhood generally, but it has to be in a place where you have the authority to do that. And not all states allow you to put a question on the ballot that raises taxes. The second category that we put things in are where we put things like Cuyahoga County and Pay for Success. They're all the weird things that definitely are not labeled as funding sources for infant and early childhood mental health, but that you theoretically could use for programs and services in that kind of catchment area. So I'd be really curious if anybody in the chat has heard of any of these funding sources: community benefits agreements, tax incentives for spending money on early childhood or infant and early childhood mental health, special taxing districts, or public-private partnerships. And then the third category is state revenue raising, and that's what you saw the Louisiana example illustrates. And there are many ways to raise state revenue. And I'm just thinking back to somebody's question in the chat earlier about what do we do about how does this dovetail with the complexity of the financial situation that states are facing right now. And I'll say it's a really good time to go to your state's budget and tax center and start familiarizing yourself with where the state actually is financially. Some states are in a surplus, some states are in a deficit, and some states are kind of holding neutral or holding even, though I'd say that's kind of rare at this point. But states are constantly tapping into new revenue sources based on changing economies and industries, changing tax rates. In a lot of states right now, there's actually attempts to shrink the pie of available funding by making big tax cuts. Folks just experienced a lot of that when they were showing state budget surpluses due to American Rescue Plan Act dollars. They cut taxes, and when those American Rescue Plan Act dollars go away, that's going to result in actual budget deficits. But that's the category where we look at things like, okay, what funding sources could you tap into in your state and dedicate to infant and early childhood mental health? So what does this work actually entail? So if you're trying to figure out if you can do kind of a Kent County or King County or Sonoma County option, we do kind of a body of legal research, and I would suggest looking and seeing if this already exists for your locality or state first. But we look at what new taxes could you add, what taxes could you increase, and could you set aside a portion of the budget for infant and early childhood mental health. We also look at something we call state enabling legislation. So is there a world in which you could pass state legislation that increases your authority at the local level to do something like Kent County or Sonoma County. In Colorado, several years back, they passed state legislation that allows for the creation of early childhood development districts. So they're allowed now at a regional multi-jurisdiction level to pass a dedicated property or sales tax that goes to early childhood development. I saw Allison mentioned the special taxing district on the ballot in Colorado in the Roaring Fork Valley. They're a part of our cohort in this area, so we've been working with them for several years now on that, and I'll be there on the weekend before Election Day canvassing for them. So that's a great example. Appreciate that you've been supporting the campaign, Allison. And maybe we can drop, if I get a second, I can drop or if Allison, if you have it, you could drop the link to the campaign website in the chat so that people can see what does that look like? How do people frame these issues when they're advocating for a special district? Roaring Fork Valley would be the first regional special early childhood taxing district in the country. There are other special taxing districts that are just the size of one county or city, and there are other county or city special taxes for early childhood, but this would be the first regional early childhood district, which is cool because you'll see if you look at the website for that campaign, you'll see that it's a district that includes some pretty rural areas. So it's not relying, to somebody's point earlier, it's not relying on one big urban center in order to administer services. It's kind of combining economies of scale. It's combining the taxing power and the kind of infrastructure and administrative burden for a region together, which is cool. So I kind of asked this question and moved on quickly. So I'm going to scroll back in the chat and see if anybody has heard of any of these untapped kind of funding opportunities being used for children and youth or for infant and early childhood mental health. Christine made a great comment about public-private partnerships, that it's tricky if there's a desire for an offboarding plan. I think in terms of private funders kind of being able to back out and leave this to being publicly funded once they've kind of funded the upfront risk. And I think that's really true. Some of these other funding strategies on here, again, these are kind of the things we draw a lot from housing and real estate development. There are a lot of public funding streams that could be tapped for economic or community development that theoretically could be applied to early childhood development or early childhood programs and services. Tax increment financing, I wish I'd put that example in here, but tax increment financing districts, I don't know if anyone lives in one, but they're essentially a way for a neighborhood or community that is undergoing development to temporarily pay less in property taxes or pay in property taxes and have those property taxes be reinvested in the continued development. It's a way to promote the like business improvement districts are similar, but the improvement or development of an area that maybe is blighted or run down or underdeveloped. I wish I could remember if it's Arizona or Nevada. I think it's Nevada, but I'm almost positive it's Nevada. Some of their local neighborhood TIF districts, instead of just reinvesting in kind of real estate development, the property taxes that are reinvested go partly to pre-K scholarships, go to early childhood scholarships in that specific neighborhood, which is kind of the purpose of me saying this here. You can really make the case that early childhood development is a community development and economic development strategy, and is huge for the economic value of property and for the economic mobility of a community. Meredith just dropped something really interesting in the chat. In New York, hospitals have community service plans to support programs to help improve SHIP goals. Yes, it's not on here, but we have a couple examples in this tracker we have of what we call emerging funding strategies of community service agreements from hospitals or community service plans from hospitals or community benefit obligations. And it's it's definitely smaller dollars than some of the other options, but at a hyper local level, it's very worthwhile looking into whether or not infant and early childhood mental health could be or is included in some of those plans. Roxanne asked about whether I've heard of any strategies in resort areas with high tourist activities, part-time residents with second homes or short-term rentals developing an early childhood strategy. If so, what does that look like? Yes, Roxanne, that's a great question. Allison might know the answer, but interestingly, in Colorado specifically, the legislature has said that I don't know if you guys have ever had this experience. You go to a hotel, and when you're checking out for your room, you see a pretty big tax. It could be like 10% on your room charge. In a lot of places, that tax, and this is why I say we like look to other industries to look for what are untapped sources of funding we could be getting. In a lot of places, the local tourism boards have been able to secure the authority to tax hotel, motel, short-term rentals and reinvest that in tourism. In Colorado, the state has said you got to reinvest part of that revenue in tourism, but you could also reinvest a chunk of that revenue in childcare or housing affordability specifically. So there are a bunch of communities in Colorado that have invested their hotel, motel, short-term rental tax into childcare specifically. So it's not quite infant and early childhood mental health, but childcare is what is allowed specifically. So that's just one strategy in a resort area. But it's been a really powerful one, and so powerful actually that the legislature said, okay, you can tax at even a higher rate than what we were allowing before. And you can tax at a higher rate than what we were allowing before, and a bunch of communities are going back to the ballot to do that. So I imagine this is probably one that people are most familiar with, but state revenue sources is kind of the last category of the examples I gave. And this is really about staying savvy about what legislation is passing to legalize something or newly tax something that you could get infant and early childhood mental health put into. Are there tax reforms that a powerful, coalition is trying to get passed that would result in revenue, part of which could go to infant, early childhood mental health? And are there things like one-time streams, like settlement dollars, like opioid settlement dollars that you could tap into? Really, part of our goal here is in a lot of places, opioid settlement dollars kind of passed the early childhood field by. And are there things like that that could come up again that we could be aware of, and next time make sure to stick our noses in and say, actually, some of those dollars should go to early childhood. So I just want to give an example of putting all of this together in one state. And I've redacted the state name just because this is kind of an active effort. But I just want to show, what does this look like when you kind of do it all? This state did a fiscal map of what the current funding in their state was for early care and education, and what would it cost to meet all their goals and build kind of a new system for early care and education. And that included a universal, voluntary, mixed delivery system with wraparound supports and well-paid educators for ages 0 to 5, available at no cost over time, with a different compensation scale on adult and child ratios. So they modeled what that would cost, which would serve about 50,000 children total, and that would cost about 1.8 billion total. And then they compared the amount they're spending in public funding currently and the total cost and found the gap. And mind you, know that some of that, that's the pie in the sky number. So there's a lot of different steps you could take on the way there, right? Like you could add funding to expand free access to a big chunk of kids. You could add sliding scale fee services. But they wanted to say, what would it truly cost? And then they did this work of looking at their neighbors and all of these different ways that states can raise revenue, and starting to compare across different types of revenue in different states and see, compared to in their state, what are undertaxed, untaxed sources of revenue that other states are using or their neighbor states are using, who would pay, how progressive, that's a technical tax term, how kind of equally and equitably would that tax burden be distributed, how much money would it raise, in order to kind of identify what's a funding source that they could go after. And they're using the results of their fiscal mapping, cost modeling, and identifying potential sources of additional funding to put in front of legislators and say, here's the problem, here's our proposed solution, and here are options of ways to pay for it. If you'd really like to make a dent, you'll pick one and advocate for it. So they're just much more set up to not get stopped by kind of those hurdles of questions that we saw in that slide with the hurdler very early on, because they have a lot of the answers. But how do you, that's great to go sit in front of a legislator with all of that information, but how do you even get in with that legislator or have enough power to make that person listen to you? And I don't have the perfect answer on levers of power, but we do have some suggestions and some insight. This is a slide I borrowed from a presentation I did, I think earlier this year or last year, I think earlier this year, for prenatal to 3 advocates in general, including infant and early childhood mental health, but also including infant and toddler care, et cetera. Generally, this area is a little bit behind pre-K or K-12, for example, on sticking its nose into tax policy and public revenue battles, where we've hung back a little bit on saying, okay, we'll fight tooth and nail to preserve Medicaid or to preserve this funding stream that funds this stuff we're already doing. But we're don't have our noses stuck as much into the tax policy and public revenue battles. And my encouragement is for folks to know enough to be dangerous here, to know enough that, if someone kind of tries to push you off or stiff arm you with a comment about, no, the state doesn't have that in the budget, that you have enough information to engage in a real good faith conversation about, okay, well, how do we make the budget big enough to pay for all the things we say we want to pay for in whatever state we're in? Broadening our coalitions and being good allies. I don't think we can do this alone. I don't think infant early childhood mental health, I don't think it makes sense from an energy standpoint to go totally alone, and for all the connected social services that and health services and programs and economic development and mobility services to all go at it alone. And I think finding alignment between the messages of this field and our allies is a key there. So I'll just walk through that a little bit more. And I want to start from the baseline of when kids are on the ballot, they win. These are some of the campaigns last year that we supported that won. And voters are on your side. So voters specifically want to see federal, state, and local government spend more on PN3. So you should feel confident that you're starting from a baseline of 75% support across the country. That's a bipartisan majority. I will say, this is our poll that we ran a couple years ago. So technically these numbers are outdated, but I look at polls from states and localities all the time. And the priority that folks are placing on maternal and infant health, childcare, and preschool has not changed, though tax sensitivity and financial sensitivity has. So on the left, these numbers really haven't changed. 75% of voters rank maternal and infant health services as a high or very high priority for federal, state, and local government spending. And then 70 and 69% for childcare and preschool. And then on the right, I do think this fluctuates way more wildly from community to community and year to year. But at the time, 2/3 of voters were willing to pay at least $100 more per year in taxes for early childhood programs and services. So just baseline, you have to start with the knowledge that there's public support for the work that you're doing. And I put together this slide of natural allies you have voters as allies, but you also have a lot in common with, and you all probably consider yourselves part of or overlapping with a lot of these other sectors. You may consider yourself an early care and education advocate. You may overlap, or you may consider yourself a mental health advocate who overlaps with the childcare and the pre-K advocates. You may consider yourself an education advocate in some way, or you may just see the ways that you and K-12 overlap. I wanted to, we'll come back to this slide again, but I wanted to just put this group up because these are all specifically coalitions or interest groups that have reached out to Children's Funding Project specifically to ask for help in raising revenue and doing revenue or tax campaigns to generate new funding. And who have message alignment and overlap with infant and early childhood mental health. So you all have some similar goals and need to use the same strategies and have messaging overlap. So that's why Allie asked earlier whether or not which I wish I'd screenshotted it, but asked earlier which of these different allies you all already know or are already connected with. But I would love to know in the chat again if you'll entertain me and just say whether any of these natural ally groups are groups that you consider yourself to be a part of or that you sit at a coalition table with. So I'll give you just a second to read them and put it in the chat. But do you consider yourself part of early childhood, early care and education advocates, or a part of healthcare stakeholders, or youth mental health advocates, or child welfare advocates, or do you sit at a table with any of these?
Olivia, great comment in the chat from Jennifer that IECMH has been funded in legislation supporting many of these allied fields. So it's affirming of that.
Yes. Thanks, Allie, for calling that out. That is an awesome point, Jennifer, and I think that's so true. If we look back at a lot of the examples from earlier, you'll see Best Starts for Kids was really not focused on infant and early childhood mental health. The goal was to fund kind of a broader range of cradle to career stuff, but infant and early childhood mental health was included in there. Or I think the same is true of childcare, right? When it also funds wraparound services or home visiting. Yeah, appreciate all the folks saying that early childhood care and education or all of these allies they consider themselves to be part of or sit at a table with, child welfare advocates, healthcare
Olivia, maybe
stakeholders.
you can talk a little bit more about what a revenue tax or budget org is and what's sort of like the in there. What would you reach out to an
Yes.
organization like that about?
Yes, thanks, Allie. That's a great point. I probably should have put a slide in here on that because that's probably the most opaque one. So there are organizations in your state, I can guarantee, that are solely focused on revenue tax and budget reform or good governance, and that are focused on making sure that there is enough funding in your state budget for all the things you want to fund, and that it's coming from places that are fair to the people in your state. And those folks are often really good allies because one way to pass tax reform or tax increases or revenue reform is by pairing it with a popular way that we could spend new revenue. So on its own, revenue reform and tax reform and budget reform is a little bit harder to get people excited about or get people to connect to or understand or listen to. And so these folks have really often found that pairing their interests, which generate new state revenue, with kid stuff broadly, but early childhood, is a winning strategy. So one place to look for an org like this would be the Center on Budget and Policy Priorities has a state priorities partnership page, and it lists their partners in all 50 states. And I'll say there's a lot of variation in those partners politically and in which allies they've aligned themselves with. But if it's a group you've never heard of, I would say that's all the more reason to connect with them and talk about where there might be alignment. Audia made a good point in the chat as well that funders also sit at tables with direct service providers, advocates, researchers, and government. And I will say funders have been some of the partners that have, there's a huge role in Allie, maybe you can drop in the chat, but funders have been in all of these revenue examples that I've shared have been instrumental and key to convening these tables and getting the work funded, and convening, and in some cases, like in Whatcom County, even driving the work to secure new funding, for the reason that someone pointed out earlier of saying, okay, if we're going to sustain this, we've got to have public dollars be the sustaining force. So when we're thinking about natural allies, it sounds like you all already sit at a lot of these tables. So you're probably already aware that the messages that a lot of these partners are using have a ton of overlap with the core messages and I'm no expert in the core messages you all use to deliver information about infant early childhood mental health, but I was looking at this resource on infant early childhood mental health and how you define it and how you talk about it. And I just noticed that some of the core messages that they were suggesting you all use when talking about this were about brain development and about academic and school success. And that just really struck me because several years ago, we did a meta-analysis of like 60 polls, state and local polls around the country from folks who were trying to raise revenue for cradle to career kid stuff. So after school, summer, apprenticeships, secondary scholarships, childcare, pre-K. And across all of those, the number one message or thematic message that popped that motivated people, whether we're talking about babies or 16-year-olds, was brain development. I thought that was really interesting, and holds true that we just had that discussion about a poll that we were looking at 2 weeks ago in Colorado. And prevention and early intervention and strengthening K-12 education were the next two. And that is, I mean, you could not have written that more perfectly with what these suggested messages are about infant early childhood mental health. I'm sure I'm beating a drum you've already heard beat a million times before, so this isn't new, but just would really encourage you to not lean away from the brain development messaging as being too wonky. It over and over proves to be really, really salient with voters. People really get, and I think thanks to a lot of the work of organizations like 0 to 3, frankly, a lot of the work done here has helped people understand that the first couple of years of life, your brain is still developing at such a rapid pace, that there are a lot of missed opportunities when we don't adequately fund supports and services for infants and toddlers. And again, prevention and early intervention, focused messaging has always worked really well, and I think continues to work, and you all know that. But these are the messages that these same folks are tapping into. K-12 stakeholders, you all know, comes as no surprise, they're using the exact same messages, and also they're moved by the same messages. K-12 stakeholders are often really moved by the fact that their job's going to be much easier if the children entering kindergarten have been well supported to that point. Affordable housing coalitions deal with child and youth homelessness all the time, and know that that's exacerbated by untreated mental and behavioral health conditions, and there are a lot of through lines there. Healthcare stakeholders, of course, I think probably understand this, as well as youth mental health advocates, and likely share settings with where infant early childhood mental health services are delivered. Child welfare advocates similarly. It's baked into their work, and then children's cabinet and collective impact bodies should be discussing this as well. So the moral of the story there is really identifying a table. You don't have to make your own table in order to start talking about revenue, and having a big enough group of allies talking about it to really be heard. I would say a lot of the work we do, we encourage people to think broader than just their slice of the early childhood issue pie. For example, fiscal mapping, we map cradle to career, and you can pull out an analysis of just infant and early childhood mental health or just youth mental health, but we encourage people to map their whole system, and to model multiple pieces of the system. And then at the other end, we also encourage people to work with their natural allies and develop shared messaging and pursue strategies together, knowing that the more of you that there are pursuing a strategy, the harder it is not to listen. So we encourage you to find, specifically would also really encourage you to find it if there is a revenue tax or budget table that's already talking about revenue issues in your community, and not be afraid to go sit at that as the infant and early childhood mental health person, with the knowledge that you have one of the highest polling things that moves voters towards being willing to invest more in government. So that was a lot of information. Hopefully just a lot of ideas to chew on. I know not any kind of specific actionable, here's what you should go do, and here's the silver bullet to solve all the problems. But hopefully that gives folks a lot of different ideas. And Allie, I think we were going to open it up to questions.
Yes, and can we just give Olivia some props for doing a great presentation with a cough and a cold trying to come the whole time. Like you're awesome, Olivia. Thank you so much for that. I wanted to take a quick second just as like for a breather, both for Olivia to be able to take a sip of tea, and then also just a pulse check that I wonder if it's kind of silly, but if you could put in the chat, you just took in a lot of information. If you were a weather right now, how you're feeling about applying all of this to your world. So for example, you could put in the chat like foggy. I'm feeling foggy about how some of this applies to my work tomorrow, or you could do any other weather about how you're receiving this content. Foggy with a chance of sun. I like that because we just threw a ton of examples, a ton of technical stuff in there too, but I mean, if the goal is a chance of sun, like, hope for funding for children and youth, that's the goal. Very inspiring. I guess that means sunny, good. Stormy, electrified. Okay, I like that people are feeling good about the call to collaborate with others on the same message. And we're seeing some hurricane and stormy. So I think it's a lot. It is a lot. Then we acknowledge that for sure. There's light and needed shade. Encouraged.
I like to think we just opened the when we do this presentation, you were in a calm, climate controlled room, and we opened the door. So a lot of weather's coming in, but there's a lot of opportunities out there to go reach out and grab, and maybe you would feel less constrained by the confines of just only being able to get the money that's already set aside for infant and early childhood mental health. And it's scary to walk out the door. There's a lot out there, but it's less limited than when you started. That was a complex metaphor, but I was trying to work in the weather.
Sorry, I just did that. I went rogue with that question, but I
No,
wanted
it's
to do
okay.
a pulse check with folks of how people are feeling. So Megan, I don't see any questions. I think Olivia addressed live the question on special taxing districts that we have in here.
Okay.
I wonder if you have any other thoughts jumping around.
Yeah, I did find, so many thoughts, but I did find one question in the chat from our dear friend Christine in Washington, and I didn't want to lose it, so I put it in my notes. She said, curious if there's an update on the tobacco tax for first five California because those dollars were sunsetting with the decline. I don't know if you answered that or not.
I didn't. I have heard things about this, but haven't looked into it specifically. So I don't have a specific update, but I am happy to ask our friends in California at Funding the Next Generation who does have a good update and make sure that we put a resource for that in the follow-up email.
Great. Thank you for that.
I see Carolyn's question, Megan, about how do we do this when we and all of our partners have real jobs. And that's an incredibly real question. I'll say the cohort we run of support for folks working on ballot measures, I say a lot of the work that I do is like professional cheerleading for folks who are taking on something like that. And they'll say it was both like the most worthwhile and invigorating experience and the most exhausting experience of their life running a ballot measure campaign. I will say that's where well-funded tables can be really helpful. Say if you're going to go out and ask for money for one thing, it would be for a part of a person's time or someone's time to wake up and think about this every day, just to keep everyone else on track and make sure they're just leveraging the smallest amount of your time possible and expertise possible. But Carolyn, I really feel that, and not to be political, but we joke in our office that it feels sometimes like it's this complicated by design to make it harder for all of us to jump in and meddle with the funding and financing of everything. And so our job at CFP is to provide services that help demystify that a little bit and return the power back to people like yourselves who have a really solid understanding of what is needed in their communities and states.
Yeah, one thing
I will
we,
say,
oh, sorry, go ahead,
oh,
Megan. Well, one thing we
I-
haven't talked about that we do at Children's Funding Project that I should mention is especially so after American Rescue Plan federal relief dollars came and then expired, you know, there's people were feeling big funding gaps in a big way, and there was a lot of demand to be answering these questions that we've laid out, these 3 questions through this webinar series. But the human capacity and the time to be able to do that was the main challenge, because it could be a full-time job for anybody for sure. So we started to sort of shift how we do things at Children's Funding Project to like a coaching model. And so if a community or a state can hire a children's funding coordinator is what we started calling it, like a person whose job, whether it's part-time or full-time, is to wake up and like literally answer these questions and do a fiscal map and do a cost model, look into funding sources, things like that. And we have like a coaching team that can work with that person. So I know there's a state level children's funding coordinator in Maryland, one in Ohio. Just a couple places are playing with that model. So that's something we could explore because this certainly isn't something you can add on if you're working with infants and toddlers all day. It's a ton of stuff to lead on your own. I'll pass that
But
back to
that's
you.
where we also shine as a field in terms of relationships and being allies. So when you were talking about allies, Olivia, I was like, all right, we got that down. I'm always looking for new folks to be friends with. And so I'm going to underscore, oh, that's not what it is. I'm going to underscore what you put in the chat. Allie, I Googled it super fast, the state priority folks. If you have not already, I got to put that back in the chat, but if you have not already gone to that website as they were talking, for your state, please do. Because I think, as you were alluding to earlier, other business sectors do this. And we, as a field, I think, are kind of late to the game in some of these areas. And so, to Carolyn's point, I think there are, yeah, Andrea, I didn't either. So I think there are people doing this in the state, and I felt so hopeful when you were talking about the polling that was done in terms of what folks really say that they will spend their money on. And that feels so solid. And again, in line with the brain development, I mean, I feel like we're getting set up here to learn this new information, but really leverage it in different ways than we ever have individually and collectively. So I'm feeling really hopeful and positive, very sunny, if you will, in the situation.
I'm so glad you said that, Megan, because I will say I feel like I should make really clear that telling you all of this is not because I expect anyone to go out and figure out, oh yeah, here's how my state should be raising more revenue, and here's which legislator I should tell that to, and I'm going to design the tax policy. No, I want you to know that the State Priorities Partnership table exists, and go get involved enough with that when they poll on what is going to motivate people to say yes to this tax reform, that infant and early childhood mental health, some way of saying that is in that poll, and they
Yep.
see compared to other priorities how popular is that, and see that it's popular enough to be worthwhile including. That's enough of a win. If you can be at that table enough to get that into the poll in some places, and I say this not as like an imaginary thing, this literally just happened at a big Midwest city that we're in, where a bunch of the business leaders who wanted to raise a tax for the general fund for the city, there were enough childcare people, and there was a foundation that was a big enough player that they were like, just put childcare in. Just put childcare in and see. I know you don't think it's
Mhm.
popular compared to other things, but just see. And it was more popular than almost any of the other priorities that the business folks had wanted to list in their poll. And that's enough that now childcare is getting dedicated funding out of that proposal. So I'm not asking, you just need to know enough to know what your role in the game is to play. You do not have to
Yes.
do it all yourself.
And that is the definition of being part of a system. And that is what we talk about all the time. And that's even just making me think of, so for our financing policy project states, there are teams that come together. And now I'm thinking of maybe we can expand that team to be more proactive in reaching out to these governance, like governance boards or these tax revenue boards that are, that you say currently exist that we're going to go find.
Yeah. Yeah. And I just appreciate, I know how busy all the folks on this call are and how much different stuff you have to learn to the points that folks are um sharing, and you already have so much expertise in so many things, but I appreciate just the curiosity that folks have and willingness to come sit for 90 minutes listening to something like this and trying to build knowledge on this. And I appreciate that it also represents how urgent this issue is for a lot of us right now. We've glossed over a little bit, obviously, the that most folks are dealing with changing federal funding landscapes, and that creates real challenges. So understand the urgency and the painful juxtaposition with how long some of this work I'm talking about can take with that, and the reality of that makes this work just really hard to slog through. So appreciate the folks who are taking the middle of their afternoon to do this.
Yes, well, I'm seeing lots of hearts and claps and thank yous. So I'm curious if anyone else has more questions to put in the chat. I think lots of people's heads are spinning right now. You're very appreciated.
Well, and I appreciate everyone for listening to me cough. I promise I'm
You,
trying not to.
no,
But
you did
they
great.
hang around. Everybody's got a cough right now. If you don't have a cough on this call, I'm certain someone in your family does. So I'm sure everybody's hearing plenty of coughing.
Very much the season, no problem.
Yes.
Okay, well, we will be efficient stewards of time and begin to wrap up here then. Allie, was there anything else that you wanted to share before I add a couple things in the end?
No, I think we'll share, Olivia and I will touch base and collect a couple links to resources based on the questions people ask that we can send in the follow-up email as well. And just you'll also have our email. So feel free to reach out to stay in conversation. And we're learning from you all about IECMH as well. We're cradle to career at CFP. So rely on you all and 0 to 3 as great partners in this space as well. So we're so grateful to be here.
Yes, we're not gonna let you go that easily, even though this webinar series is over. I think we've got more plans and ideas to keep this moving. One last quick question in the chat. Sarah wondered about social impact bond. Any resources or readings?
Yeah, I think one of the resources that Allie is going to share a link for with you, Megan, to send in follow-up has a section on social impact bonds. But Sarah, also feel free to just shoot us an email. And there's lots of different rabbit holes I can send you down on that.
Awesome. Thank you. Yep, we will include all of those. All of you will receive an email with the I think we've been adding on, so we'll send through a link for all of the recordings, all of the slide decks, and some of the resources as well that you've all shared. I just put in the chat a reminder for November 18th. We have another national webinar on CCBHCs and IECMH, so please sign up for that. And last but not least, I failed to mention earlier when we said hello. It is Celebrate Babies Week, ladies. I don't know if you knew that, but what beautiful way to round out our webinar series than to celebrate babies with all of you. So we want to close out with a little bit of fun and be sure to say thank you to each of you for all of the work that you do every day for babies and families in your state. So we're very grateful. Let us know how we can help you, and we'll be in touch.
Thanks, Megan. Thanks for
Thanks,
the
everybody.
opportunity. I really appreciate it. Bye.